Hi everyone, my name is Muhammad Jan Fadilah. I am from Pelita, Ciampea Health Vocational School. In this video, I will provide information about stroke and mirror therapy method to optimize movement in the elderly. Let's see the following explanation.
Menurut Badan Kesehatan Dunia WHO, penderita hipertensi atau darah tinggi terus meningkat secara global. Diprediksi pada tahun 2025, sekitar 29% orang dewasa di seluruh dunia akan mengidap hipertensi. Lalu, bagaimana di Indonesia? Hipertensi merupakan salah satu faktor penting pemicu penyakit tidak menular seperti penyakit jantung dan stroke yang saat ini menjadi momok penyebab kematian nomor wahid di dunia.
Penyakit stroke menjadi penyebab kecacatan dan kematian nomor 1 di Indonesia. Stroke dapat menyerang siapa saja tanpa memandang usia. Menurut data Kementerian Kesehatan, sekitar 80% warga Indonesia belum mengetahui gejala dari penyakit stroke. Menjadi sebuah kewaspadaan karena penyakit stroke terjadi secara tiba-tiba dan tak terduga.
The many cases of uncontrolled cardiovascular disease will cause dangerous complications, namely severe hypertension, heart attacks, and stroke. In this era, these diseases are not only suffered by the elderly, but also by many productive age. Hypertension is a supporting factor in the occurrence of stroke. Hypertension is often referred to as the silent disease because many sufferers do not know that they have hypertension before checking their blood pressure. Hypertension or high blood pressure is a condition when blood pressure is above normal limits. In fact, this disorder can increase the risk of heart disease, stroke, and even death.
According to the World Health Organization, Indonesia ranked first as a country to experiencing stroke throughout Asia. Indonesian national data shows that stroke is the highest cause of death, which is 15.4%. Around 750,000 people per year are experiencing stroke, and 200,000 of them experiencing recurrent stroke. West Java province has a prevalence of 11.4%, or an estimate 131,846 people. To the West Java Provincial Health Service, around 10.9%, equivalent to an estimate of 2,120,362 people experience stroke. Stroke is a condition that occurs when the blood supply to the brain is disrupted, either due to blockage or ruptured blood vessel. This condition causes brain cells to lack oxygen and nutrients, which can damage brain tissue and cause impaired body function. Hypertension and stroke is often attack the elderly. One of the factors is the decline in organ function as the part of the body physiological process.
Elderly is someone who has entered the age of 60 years and above. PPS group are elderly into 3 age groups, namely young elderly, middle elderly, and old elderly. Signs and the symptoms of hypertension: headaches, especially in the back of the head, vertigo, tinnitus, vision problem, shortness of breath, chest pain, arrhythmias, fatigue. When the symptoms are ignored, the condition can become more serious and can even trigger a stroke. Signs that someone is having a stroke are weakness or numbness in the face, arm, or leg, difficulty speaking, difficulty seeing in one or both eyes, difficulty walking, dizziness, loss of balance, or lack of coordination. Hypertension causes an increase in blood volume in the body, causing vasodilation of blood vessels in the brain, and causing arteriosclerosis or blockage in the arteries by fat. So, that blood fat easily enters the blood and causes a decrease in elasticity of blood vessels, causing brain ischemia and causing ruptured or cerebral vessel, resulting in stroke.
Mental health activities that can be done by the elderly are to help to create a positive environmental atmosphere, remain productive in this doing things they like. Train the elderly to expose their feelings and to the memory exercise to prevent dementia. The activities that can be done by the elderly that can prevent hypertension and stroke are doing activities with close people or family and continuing to socialize with the surrounding environment. Doing activities outside the house with the community if the elderly do not have obstacles in carrying out activities. Spiritual activities that can be carried out to elderly include worshiping, participating in religious activities, and always being supported by the family in carrying out spiritual activities. Prevention of hypertension and stroke can be done by maintain ideal body weight by living healthy lifestyle and regulating diet or losing weight in overweight or obese condition. Healthy diet, consumption of fresh fruit, vegetable, fish, and the use of olive oil are also recommended. Avoid smoking habits and exposure to cigarette smoke. Avoid alcohol consumption. Regular exercise for at least 30 minutes every day or 150 minutes per week. Sport that can be done such as aerobics, walking, running, and cycling. And if the client has experiencing stroke or symptom of stroke, the client can apply the mirror therapy technique.
Mirror therapy for stroke patients is a therapy technique that uses the reflection of healthy limbs in a mirror to help stroke patients move the affected limb. Patients see the reflection of their unaffected body, with the reflection of like seen by stroke patient can generate motivation to move their affected limb. Benefits of mirror therapy: improve motor function, reduce pain and discomfort, increase nerve activity, helps patient regain control over the movement of affected limbs. Important to remember, mirror therapy does not replace other physical therapies, but can be used as an adjunct to improve recovery after stroke. If a patient experiences difficulty or pain while doing mirror therapy, they should immediately consult a doctor or physiotherapist. Mirror therapy should be done under professional supervision, especially in early stage of recovery. Here's how to do mirror therapy for stroke. 1. Preparation. The patient places the healthy limb in front of the mirror, while the stroke-affected limb is hidden or not visible. The mirror should be positioned so that the patient can see the reflection of the healthy limb clearly. 2. Movement. The patient look at the reflection of the healthy limb in the mirror, then perform the same movement on the limb affected by the stroke. Movement can be simple. Movements such as raising the hand, bending the leg, or doing the finger movement. These movements are performed slowly and in a controlled manner, with a focus on restoring motor function. 3. Exercise. Mirror therapy is done regularly 2 or 3 times a day for 10 to 15 minutes. Exercise can be done at home or under the supervision of a professional such as physiotherapist.